We are covering adverse donor reactions and the Lookback program, critical topics for your phlebotomy certification exam. The exam will test your ability to recognize and, most importantly, immediately react to these situations. Let's start with the most frequent reaction, a vasovagal response, or fainting. An exam question might describe a donor who suddenly becomes pale, starts sweating, and complains of dizziness. Your first action is not to offer them juice or ask them to take deep breaths. It is to immediately stop the donation, withdraw the needle, and place them in a supine position, ideally with their feet elevated to encourage blood flow to the brain. The exam wants to confirm you prioritize patient safety above completing the collection. A common trick question will involve choosing between continuing the draw and stopping. Always choose to stop. Another highly tested scenario is the formation of a hematoma, which is essentially a bruise that forms when blood leaks into the tissue around the vein. A question will describe swelling and discoloration at the venipuncture site. The correct sequence of actions is crucial and often tested. First, you must release the tourniquet, then remove the needle, and only then apply firm pressure. A common exam trap is an option that has you apply pressure before removing the tourniquet, which would only worsen the hematoma by trapping more blood in the arm. Now, let's discuss nerve injury. Pay close attention to how a patient's pain is described in a question. If they report a sharp, shooting, or electric-like pain that radiates down their arm, this signals nerve involvement. Your only correct answer is to immediately stop the procedure and remove the needle. Do not simply try to adjust the needle, as this is a classic incorrect option designed to trap test takers who hesitate. For apheresis procedures, the exam will test your knowledge of citrate reaction or citrate toxicity. This occurs when the citrate anticoagulant, used to prevent clotting in the machine, binds with the donor's calcium, causing temporary hypocalcemia. The key symptom to watch for is perioral tingling, which is a pins and needles sensation around the mouth and lips. The correct response is to slow down the rate of infusion and notify the appropriate medical staff, as calcium may need to be administered. Don't confuse this with a standard vasovagal reaction. The tingling linked to an apheresis machine is the specific giveaway. To remember the universal first steps for most adverse reactions, think of the word safe, stop the draw, assess the patient. Follow protocol for positioning and vitals, and finally, educate and document the event. This simple mental checklist ensures you always prioritize the patient's immediate safety. Lastly, shifting to post-donation procedures, you must understand the Lookback program. An exam question might state that a unit of donated blood tests positive for an infectious disease marker, like hepatitis C, days after the donation. The purpose of the Lookback process is to trace and notify any recipients who received blood products from that specific donation. The exam is testing your understanding of public health responsibility and the critical importance of traceability of blood components to prevent any further disease transmission. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word.com.